Hello, this is Dr. Gay from First Look MRI, and this is a patient who jumped out of a truck and landed badly, and they have ankle pain. They have some injuries in their midfoot, but really we're going to look at the ankle in this patient. So as we look at the ankle here in this sagittal T2 fat set sequence, we see this vertical fracture line, posterior malleolus, see fluid in the ankle joint here, so we know bad things are going on. And we're going to put up a sagittal T1 weighted sequence, and sure enough, you can see that fracture line a lot better here. And typically they'll have fractures of their malleoli as well, their medial lateral malleoli, along with this posterior malleolar fracture. So we're going to look to see if we see that. And we put up our coronal view, and boy, it looks pretty good. I don't see a fracture of either, which is interesting. And now we're going to look at the ligaments here. And we're going to put up an axial sequence to look at the ligaments. So here we go. This is axial image. We're just below the ankle joint. This is the talus up front, and this is the fibula. So the anterior, this is the front and back, so the anterior talofibular ligament comes off the fibula here, goes forward, and it looks like this is part of it right here. It may be partially torn towards the top, but if we go down one cut, we do see something come across here. So I'd say this is maybe partially torn, not completely torn. And we'll also look back here for the posterior talofibular ligament. Again, this is the anterior talofibular ligament. This is the one that is typically torn. Again, they have some intact fibers, and the posterior talofibular ligament comes horizontally, and this is the one that's almost never torn. So I don't know if I've ever called that torn, or only in extremely rare cases. Don't really see it as well here as I'd like to, so we're going to put up the coronal view to look. And this is the coronal view, is the fibula, talus, and we can see this coming across here sideways. So there is the posterior talofibular ligament is intact like we'd expect. If we go to the anterior talofibular ligament, it's over here. And that may be partially torn, but I do see some intact fibers. So now we're going to go up to the tibiofibular ligaments. We're going to move on up to the level of the ankle. And again, over here, this is abnormal to see fluid here. This is fluid in the anterolateral gutter, and this is associated with ligament injuries. So we're going to come on up, and here's where we should see the anterior tibiofibular ligament. This is the tibia now we're in. This is the fibula, and just looking out here, these are pretty small and hard to see sometimes, but this time I definitely cannot see it. It looks gray and ill-defined, so this is a ruptured anterior tibiofibular ligament. And now the posterior tibiofibular ligament is a little bit more difficult. You say, well, maybe there's a little band over here. This may be it. And this is very common, where the posterior tibiofibular ligament and anterior as well, you just get an idea that I think I see something, but there a lot of times not much more than this, just a little wisp. But I believe this may be partially torn or sprained. And the next thing to do is to look at the interosseous membrane here in between. If we go on up here, we see there's fluid between the tibia and fibula. So this is worrisome. It looks like there is injury of the syndesmotic ligament or the interosseous membrane. And sometimes you can see a little black line in between. I don't see that nice, well-defined black line. So that looks like it is torn. We're going to put up another view here in the coronal, plain to see. And almost always you should be able to see some black line coming down obliquely, bridging these together. But here, all we see is bright all the way down. I do not see any nice, well-defined dark black line. So this is a torn interosseous membrane or syndesmotic ligament. It's not really widened here, which is interesting. But again, this is too gray, too abnormal. And when you see this, we call this a high ankle sprain. The lower ligaments were okay, but the higher ligaments are torn. And now when we see this, we want to look in at the fibula. See, sometimes they have a fracture of the proximal fibula as well. So we asked them to get a plain film, and sure enough, here's a fracture of the fibula. Now there's one other thing, the calcaneofibular ligament down low. So this was that posterior talofibular ligament. And there's another one down here. This is small and hard to see, but it comes off the calcaneus, and it comes up here to the bottom of the fibula. It looked like their calcaneofibular ligament was probably intact. I do see some fibers there. But here on the axial image is not as well seen, so I think this is partially torn at least. So this is part of here, this linear band. Looks maybe some periosteal stripping here. Normally it's a little more straight. You can see a little bit better. It wraps underneath here, the perineal tendons. As we go up, up, whoops, up. There's a little linear band here, that's it. It goes up. We don't really see it very well. Up, up. And then here's the tip of the fibula. So again, it wraps under here. It's very small. This is part of it here. It does look a little uplifted, so it looks like it is at least partially torn. So in the end, this is a high ankle sprain with a fracture of the fibula. among other things. So thank you very much.